Okay. It's 4 o'clock. We'll call the meeting to order. And certification of open meeting law requirements have been met.
Yes.
And we have a quorum. Minutes of prior Human Services Board meeting.
They were sent out.
I make a motion to approve them.
Motion by Jeannie, second to that.
I don't see any corrections.
Second by Sally. Okay, all those in favor signify by saying aye.
Aye.
Opposed? Okay, we'll go on to public comment. Is there any?
There is not, but I would like to do introductions for there's a number of people online with us today, a number of them from area legislators' offices. We're going to talk to them a little bit about the 2021-23 state budget. We also have some individuals from the healthcare center I see on as well. So I'm Deb Sukla. I am the Human Services Director here at Trempealeau County, and maybe we'll do introductions in the room first, and then we'll go for those of you online.
Curtis Goyen, I am on the Board of Supervisors, District 16. John?
John Austin. I'm chairman of the board, just sitting in on today's meeting.
Diane?
Diane Trader.
Sally?
Sally Miller, County Board, District 3.
And Jeannie.
Jeannie Nutter, County Board Member, District 15.
Sandy Polkowski, one of the Economic Support Supervisors in Trempealeau County. Dana Lee, I'm an Economic Support Supervisor also in Trempealeau County.
I'm Tori Getter. I'm the intern for CPS under Kendra.
I'm Erin Herber, Family and Children's Services Supervisor.
And I'm Wayne Opitchka, Justice Unit Supervisor.
Okay. So on the phone, would you like to introduce yourself, please? Starting with Karen.
I think
We
Karen's
don't
on
hear
mute.
you.
There you go. Hi, I'm Karen Sepich. I'm a community member.
Whoever wants to go next.
Hi, I'm Terry Summer. I'm the administrator at Trempealeau County Healthcare Center.
Hey everyone, Bo Stafford representing Senator Jeff Smith.
Thank you.
Hi, I'm Nathan representing Senator Kathy Bernier.
And you have State Representative Jesse James.
Okay.
Jerry Dietz, Administrator at Trempealeau County Healthcare Center, Executive Director.
Thank you. The next item on our agenda, well, you, particularly those of you who are from the legislator's office, we sent you a copy of our 2020 annual report, and we're going to be presenting that to our committee, and then we're going to launch into some of the budget items. If you would be so kind as to sit with us through this annual report presentation, in part because it really gives you a good picture of what it is that we're doing here at Trempealeau County Human Services. So is that okay if I launch right into that?
Go right ahead.
So we have a number of the unit supervisors here who will take a couple minutes and they'll talk about their sections of the report. It's the same format as we have done in the past. I do want to highlight a few things. Obviously, COVID was a very different year for us in 2020 than any previous year. And we really learned a lot about how to do our work through using all kinds of technology, not just for our staff working remotely, but as a means to be able to serve people in the community, to be able to have eyes on with people. In spite of COVID, we were able to get 2 new grants this past year. We were able to get the Dementia Care Specialist Grant, and we were able to get the Community Partnership Grant, which Wayne will talk about later on in his report. As far as the numbers, general comments, while schools were closed during COVID, we started out the year in child referral, and Aaron will touch on it a little bit more. We started out 2020 really high with the number of child protection referrals that came to our office. But when schools closed and caregivers didn't see kids as much, other caregivers outside of families, the number of child welfare referrals really dropped dramatically. But one of the areas that really grew dramatically for kids was in terms of truancy, with a lot of kids doing virtual schooling or supposed to be doing virtual schooling. If they weren't attending or they weren't getting their assignments done to a certain level, those were turned in for delinquency, and we've seen a big increase in that. By far, we are not the only county to have that. That's pretty typical across the state. The other area that we saw a huge increase during COVID was individuals in the community struggling with mental health and substance abuse issues. We saw a number of people come to our attention, individuals that were never, ever on our radar before, people that were doing just fine until their natural supports, such as going to the doctor, seeing family and friends, going to work, the structure of everyday life was gone, and suddenly that made life very difficult for these individuals. So we did see some pretty big increases in our behavioral health services area, particularly in the mental health placements. The other big change for us was the services for seniors. A big decline, obviously, in the transportation program because we wanted to make sure that we kept seniors safe as they were the most vulnerable population under COVID. And as far as the nutrition program, we saw a change in our home delivered meal program. It went up because many of the congregate meal sites had to close. In fact, we just did a survey last month across the state, and there's very, very few, if any, congregate meal sites open yet. As more and more people are getting their vaccines, we're hoping that we can look at opening ours soon. There will be a discussion, one of our big topics of discussion at the ADRC advisory next month. So I just wanted to kind of give you a heads up on that. We also played a big role in, Human Services Department did, in terms of being part of the countywide COVID Operations Committee, as well as working with the clerk's office for the CARES and FEMA funding. Financially, we are projecting a positive year. We are looking that we had a net at the end of the year of $265,189. $190,000 of that is in Fund 202, which is the Human Services Fund. $100,000 of that, and again, this is not audited figures, these are our projected figures. $100,000 of that will roll over into the Senior Nutrition Program Reserve Account, so that will be great. And then we expect that there'll be maybe around $90,000 that would go to the general fund. Again, this is all contingent on the audit report, which will come out in August. Fund 203 is looking at a pretty sizable reserve, and the big reason for that is we were able to draw down a good amount of COVID funding for the nutrition programs and some caregiver programs. And so, again, these numbers are our best guess estimates at this time until we have the auditors come. So at this point, I'm going to turn over to Erica Anderson, and she can talk a little bit about the behavioral health services and hit some of the highlights for that area.
Thank you. So I'm just going to kind of go over some of our enrollment numbers and discharges for our different programs through the year, and then kind of talk about crisis and inpatient services. So first, in our Comprehensive Community Services Program, CCS, we had 14 new enrollments in 2020 and 8 discharges. As of December 31st, we had 34 individuals enrolled in CCS. 5 of those individuals were adults and 29 children. That has kind of been the trend in our county in particular and across the state, that we see more children enrolled than adults. In our community support program, we had 4 admissions enrollments in 2020, only 1 discharge. And as of December 31st, we had 16 adults enrolled in that program, which is up from 13 the prior year. Outpatient services, so these are services in which we assist with some funding for individuals that don't have insurance or Medicaid benefits. We only served 4 individuals for mental health and 14 for substance abuse. Now, I want to point out that you'll see a change. Those numbers have decreased probably somewhat significantly over the past several years, but that is simply because we are better at getting individuals enrolled in Medicaid and other insurance programs, so people have insurance and get connected to resources that way. So that's a positive thing for the county. Crisis services, there was a significant increase in crisis calls last year. Northwest Connections took 500.
If you're online, can you make sure you're on mute? We're hearing some feedback. Thank you.
It's a really weird noise. Anyway, so our crisis calls were up to 528. That was 387 only in 2019. So some significant increases. That's part of what we felt, I think, a little bit from COVID is some crisis contacts from individuals that we normally are not getting crisis calls from, or different populations of people. Our emergency detentions were also significantly increased. We had 67 emergency detentions for mental health in 2020, and that's up from 51 in 2019. Looking at residential treatment, so individuals that we are serving in residential treatment facilities for mental health, we serve 7 individuals at a total cost of $130,000 and some change. That's a fairly significant increase from the prior year, which was $85,000. Substance use treatment, we serve 13 individuals, and the total cost of that was $45,616. For inpatient services in mental health, we served 31 adults and children for inpatient mental health treatment, and we served 3 individuals inpatient for substance use treatment. Those numbers are also an increase from 2019. Kind of switching gears to our birth to 3 program. So we're going from adults to our littlest individuals. We had 29 new enrollments in birth to 3 in 2020. That is down from 44 in 2019. We had 42 discharges, which is pretty normal, in that normal range for us. And as of December 31st, we only had 24 children enrolled in that program, which is a decrease. Now that program did see a slower amount of growth, but I think that goes back to, I can tell you in 2021, we are not seeing the same pattern. We've had a lot of referrals coming in for birth to 3 services. And I think part of that is just kids were not going to doctor's appointments. They weren't, going to school functions, anything like that. So they weren't getting recognized out in the community.
Another source of referrals for birth to 3 is it's called CAPTA, but it's through the child abuse referrals that come in. And again, as those numbers were down for a large part of this past year, it would make sense that birth to 3 would be as well. Sorry to interrupt.
No. And so the last program I'm going to talk about is Children's Long-Term Support, otherwise known as CLTS. We only had 10 new enrollments. We had 9 children discharged from the program, and as of December 31st, 76 total children enrolled. Our enrollments are down, but we are still one of the counties, one of the highest counties in the state that has the highest number of percentage of potentially eligible kids enrolled in that program. So we're pretty proud of that number, because I think it's due to our outreach and our relationships with school districts and other partners in the community.
And we have no wait list in that program, which has been something that has gone on for years. There are some counties that are struggling with wait lists. I know Eau Claire, just north of us, has some pretty sizable wait lists, and they're struggling with trying to get those kids served. So we're pretty proud of being able to do that. I'm going to turn it over now to Sandy Polkowski and Dana Lee for the economic support programs.
All right, thank you. The Economic Support Unit in Trempealeau County is operated in collaboration with 7 other counties as a part of the Western Region for Economic Assistance, also referred to and known as RIA. In addition to La Crosse County, who is our lead administrative agency for the multi-county consortium, RIA includes Buffalo, Clark, Jackson, Monroe, Pepin, of course, Trempealeau, and Vernon counties. So RIA provides assistance to vulnerable and low-income households in meeting their basic needs. The programs that are administered by the Western Region Consortium include Food Share, Badger Care, Medicaid, Caretaker Supplement, and the Wisconsin Shares Child Care Subsidy Program. Our economic support workers need to remain current on a variety of programs of assistance and policies for the Food Share, Badger Care, Medicaid, and Caretaker Supplement programs, as well as child care. So first, to talk a little bit about the medical assistance programs. In the year 2020, we had 6,210 individuals in Trempealeau County receiving medical assistance benefits, which amounts to about 22% of the total county population. We also had total Medicaid expenditures to recipients in Trempealeau County totaling $44,168,993. If we do a little breakout as to the number of recipients per program, we had about 4,042 recipients receiving family-related Medicaid benefits, 690 childless adults, 563 Medicare beneficiaries. That is a program where the state of Wisconsin assists with paying an individual's Medicare Part B premium, and in addition might supplement some Medicaid benefits as well. We have a Medicaid purchase plan program for disabled individuals who are working. We had 161 recipients. Folks in a nursing home, 147 recipients. SSI-related Medicaid, 207 recipients. Medicaid waiver program was 215 recipients. The IRIS program, 39 recipients. The waiver and IRIS programs together are our family care programs. And then also our family planning waiver had 146 recipients in Trempealeau County.
Okay, I'm going to talk a little bit about our food share assistance program. So on average, or for the year of 2020, our food share benefits provided to Trempealeau County residents were $2,768,571, which amounts to a 20% increase over 2019 benefits. And on average, 3,301 Trempealeau County residents received food share each month, which is a 59% increase from last year. Our child care assistance program, we have on average 25 families, including 43 children, who received child care assistance in the year of 2020. And the 2020 child care benefit to Trempealeau County families was $209,241.
Thank you, Sandy and Dana. I'm going to turn it over now to Erin Herber, Supervisor of the Children and Families Unit, to just hit some of the highlights in her area.
All right, so in 2020, our numbers actually looked a little bit different because of the pandemic. We received 413 referrals of child abuse and neglect, which was down from 440 in 2019. January was our busiest year with 55 referrals received in that month, and then 44 referrals received in December, which looked a little bit different than our normal years, which falls about March and September as our busiest months. Of those 413 referrals, 131 were screened in for investigation, which is down from 159 in 2019 and even further down from 214 in 2018. Of those, about 21% were screened in as a same-day response, so needed to be acted on within that same day that they were received. In 2020, we removed 15 children from their parental home, with 0 to 4 being the highest age group with removals with 8 children. The two primary reasons for removal were caretaker drug abuse and neglect, with an interesting one of caretaker alcohol abuse being not far behind those two. Of those 15 children removed, 12 were initially placed in foster care and 3 were in a relative kinship home. We had 5 termination of parental rights, which is really the last thing that we want to be seeing happen. But for 2 children, that was wonderful news for them, as they had been in out-of-home care for 5 years, which was over half of their lifetime. The number of CHIPS cases filed in the courts was the lowest that we have had in 5 years, with 16 new CHIPS cases filed in 2020. Which was down from 28 in 2019 and 67 in 2018. And I'd like to account some of this to the Targeted Safety Services funding grant that we received in 2020, which looks at creative ways to be able to maintain a child in their parental home through protective planning and safety planning. We had 14 children enrolled in that program, and of those 14 children enrolled, 12 were able to be maintained in their parental home, with 2 ultimately being removed from their home.
Thank you very much, Erin. And I'll turn it over to Wayne Opitchka, the Supervisor of the Justice Unit.
And the Justice Unit serves 3 categories. We cover recovery court, our youth justice, and our diversion program. As Deb mentioned earlier, we got a 5-year youth diversion grant last year. Its purpose is to divert youth from the justice system, identifying mental health and substance abuse issues, and working closely with school districts and law enforcement. So in our youth justice in 2020, we had 45 referrals to juvenile court intake compared to 67 in 2019. We had 34 truancy referrals compared to 29 and 19. And so far this year in 21, I'm up to 34. And that part of that is when kids aren't checking online, they're not turning their homework in. It's really frustrating doing virtual schooling. So the majority of the cases in the juvenile system are handled through some type of a diversion, either a deferred prosecution agreement or what's called a consent decree. The majority offenses are disorderly conducts or property crimes. The next category is our treatment court. We call it recovery court. We served 15 participants in 2020. 3 of them were alcohol-related offenses. 12 were drug-related offenses. Out of the 15, 3 were females and 12 were males. In the third quarter of last year, we had to cease drug testing due to the pandemic. We went 3 months without drug testing, but the participants were notified there was going to be hair follicle testing that can detect drugs in the system for up to 3 months. And out of the 7 that tested, all 7 passed. We had 3 terminations in recovery court and 6 graduations last year. And so for our diversion program, we served 57 new cases in 2020, averaging 4.75 per month. In the diversion program, we collected over $15,000 in restitution, over $6,400 in diversion fees, and our recovery court fees collected nearly $2,800.
Thank you, Wayne. The ADRC, I will present that one because we don't have a supervisor in that unit right now. The number of calls that came in was practically stagnant from 2019. In our elder benefits program, the number we served dropped a little bit, partially because I think people were not comfortable coming into the office. And then we have some information on the demographics for those individuals. The disability benefit specialist is a program that really was not in operation much of 2019. In 2020, we were able to get it going again. We had to reconfigure that position. And so we actually served 34 people in 2020, and 32 of them were new enrollments. So Shelley Rui has done a nice job of getting that rolling again. Our adult protective services is an area we've seen a lot of growth in. In 2018, we had 82 referrals. In 2020, we had over double that amount at 165 referrals. Our guardianship numbers remain pretty stagnant. Again, our big changes are in the senior nutrition program, that we did deliver 18,186 meals to the homebound seniors in our community. And typically, we would have about 18,000 meals in the congregate program, and we only had 2,000. So that was our big decline. The transportation program in the report that you have is highlighted because that is not updated. Without the supervisor there, I did not get this information in time before we present this to the county board, though I will make sure I get those updated numbers. I do apologize for that confusion. So that's our annual report for 2020. By statute, we're supposed to deliver one to you every year. We'll be taking this to the county board next Monday night. We'll have a nice PowerPoint to accompany it. And wondering if you have any questions and any comments.
This is Jeannie. I just have a comment. I just would like a shout out to all your staff, how they really pulled together this year. It kind of always makes me choke up. because you know how much I love social workers. But they were out there in the front lines doing stuff, doing home visits, taking care of kids, working under some crazy, we've all been living under some crazy times. But I just really want to thank all of you. You have done a great job. Good work.
Thank you. March is Social Worker Month, by the way, so glad you mentioned that.
Congratulations. You should celebrate every day. You've chosen the best field in the world.
And, I think the staff did a beautiful job of really figuring out how do we serve the people in our community with what tools can we use. And people were very creative and have pushed us in a lot of unique ways. And I think we did a beautiful job. Again, drug testing continued. Wayne found new ways to do that. We continue to serve more people through behavioral health. When we weren't getting kids referrals, we were, trying to figure out how can we get those kids served. With the economy being what it is, obviously there was a lot of pressure in the economic support unit. So everybody did a really phenomenal job in conditions we never thought. But it is really about pulling together, Jeannie, and I think that's really the key to it. So
And
thank you for recognizing
Rick,
that.
we'll have a lawyer appreciation day, like maybe in May. No, you've been a great help to this group.
Does anybody online have any questions or comments regarding the annual report?
You want a motion to accept it?
Yes. With the exception, we'll have to update the transportation numbers.
Yeah. Okay. Motion to update the report with the elimination of the transportation due to it's going to be updated.
Yeah.
Any motion on that?
I make a motion to approve the report.
Motion by Jeannie. Second. Second by Sally. All those approve signify by saying aye.
Aye.
Opposed, same sign. Carried. Okay, we'll go on to the state budget updates.
Sure. So thank you all for joining us, legislators. We sincerely appreciate your time in talking with us. This saves you driving down here, so that's kind of nice, this remote thing. It's just not quite as personable. We did share with the board members and with those of you representing legislators and the legislators themselves, a part of a document that we received from the Wisconsin Counties Association with some summary of some budget items. The WCA will be having their day at the Capitol on April 13th. We will probably not be at the Capitol because I don't even know if it's open. Maybe you all could tell us that, a better answer to that. And so our job is to reach out to all of you. We had scheduled this with this committee several months ago. By April 13th, WCA will have some position papers on some of the issues we're going to talk about today. I don't have those for you today, but I will certainly be forwarding those on to you and in an email, and I'll be glad to communicate with you. I'll give you a summary as to Trempealeau County's stance on it. But if you have any questions, any of myself or any of our unit supervisors would be more than happy to answer any of the questions. I do want to highlight a few of the items in this budget that are some areas that we do want to point out. On page 2 in the document that I gave all of you, towards the bottom, there's some funding under lead poisoning for birth to 3, and then there is some birth to 3 funding. The $1.125 million for birth to 3 was additional funding we got this past budget, and it has made a big difference for our program. It really increased our state funding by about 1/3. So it's not a lot of money in the state budget, but it's real money to us. There's also some good amount of money, $3.3 million in fiscal year '22 and $6.6 million in fiscal year '23 being allocated to birth to 3 program for children that are lead poisoned. And one of the things, I hear many things about the birth to 3 program, but I never hear people saying, oh, if we could just serve more kids that are lead poisoned. That is not a priority there. That may certainly be some part of the population. We desperately need additional funding in the birth to 3 program. It has all counties, not just Trempealeau County, but all counties have struggled heavily under this program because there is no wait list. It is an entitlement program. If they're eligible, they're served. more and more families, because the economy is good in Trempealeau County, or has been good, more and more families are covered by private insurance, and private insurance pays little, if anything, for birth to 3. So that continues to put a lot of burden on the local taxpayers. So getting additional funding for birth to 3 is really important to our county. What we would like is some flexibility that maybe wouldn't tie it as closely to the lead level issue, because what I can tell you what will happen is that will create a lot of administrative work for us to have to assess all this lead level situations with kids, and we may not be able to spend all that money. The counties need that money, but we are really asking that we have some flexibility for birth to 3, and I know this will be one of the issue papers that WCA will be coming out with. Another area that's important to us is the mental health services. There is funding in here for 2 regional crisis response centers, although I've been told by WCA that this is not part of the package that Senator Bernier put together, and perhaps Senator Bernier's staff would be able to help update us on this. We need beds. We increased the amount of spending that we did for the state adult placements this past year by 90%. And hauling people 4 hours away from their home, away from their loved ones, handcuffed in the back of a law enforcement vehicle is a terrible way to serve people who are having mental health crises. If we can serve them more locally, is desperately needed. We certainly support the advocacy that Senator Bernier and many of you that have joined her in wanting to have regional centers in the Eau Claire, Chippewa Falls area. But we continue to say that that's extremely important. The other piece in mental health that's very important is they're looking to create 5 crisis stabilization facilities across the state with up to 16 beds. And again, crisis stabilization goes hand in hand, and so I think that that's a very important piece. I don't know, Eric, is there anything else? I'm just kind of going very quickly on this because I want to make sure we use people's time wisely. Are there any
No, I'm
other-
just going to highlight the need for hospital beds in the Western region. I mean, you know, and these crisis stabilization facilities are great, what it looks like on paper anyway. It's not very specific as to what's in the budget. But in the one, we're looking at 2 inpatient psychiatric beds. That does nothing to address the needs in the Western region. We saw we're every year continually we're sending more and more and more people to Winnebago, and that's just it's really just not an okay thing. So we need beds. That's my message.
And I don't know if any of you who are representatives or staff on behalf of representatives have anything you'd like to add at this point or have any questions for us?
Representative James, do you want to speak up since you are the assembly lead on Senator Bernier's legislation?
Absolutely. Well, I think it's good to hear counties in support of the mental health beds with the private-public partnership with HSHS being able to get one-time grant funding of about $15 million to add these beds to our area. This is obviously a huge challenge that we still face and battle today. I'm still in law enforcement, and we're still making trips to Winnebago, even with the services so close with Mayo and Sacred Heart nearby. Sadly, the trips are still being made to Winnebago, and obviously that's a huge passion of mine to help in this area. I know that this is something that is still in the budget, something that Senator Bernier and I are still circulating a bill currently for this initiative, and we're still fighting for it for our area. This is a huge win-win, not only for the Chippewa Valley area, but for our entire state. Because we know for a fact, and statistics have proven that those in the southeastern part of our state have brought patients to Sacred Heart Hospital. And that is something that if we can relieve the pressures from our area going to Winnebago, those in the southeastern part will be able to go to Winnebago, and hopefully our people, up to and including our juvenile population, remain closer to home where they need the support services of their family and loved ones, and being able to see them and get these services that they need more expediently than what they are now.
Thank you so much. And however we here at Trempealeau County can help advance that message throughout Madison, we'd be more than happy to help out. It's a shame it didn't go through last time, and I'm appreciative of all the work that's being done on this side of the state around that issue. I'm just going to keep trucking through this report. So on top of page 5, it talks about some increased funding for the ADRCs, for caregiver coordinator, some advertising and marketing to get the word out, some additional tribal services, as well as having dementia care specialists in every county. And of course, having the dementia care specialist, considering how the aging population is growing and the dementia is becoming more and more of a crisis in many families and in many counties, is certainly an area that is very important. The counties did advocate for increased funding to ADRCs in general. I don't know if WCA is going to be doing a paper on this, but I will tell you that there's been an enormous amount of work done between counties and Department of Health Services for about a $27 million request for increasing funding to ADRCs. Trempealeau County and our neighbor Jackson County are two of the pilots in the ADRC programs. We started when they were just kind of testing out the idea. And when they said, what will it cost you to do it? Those who were here prior to me asked for a lot of money, and we've been able to sustain that funding. But I can tell you that there are ADRCs across the state that do not enjoy the opportunity to fulfill what is expected of us in ADRCs the way we are in our two counties. We would like, if there's additional funding, we will get very little of that additional funding, but other counties will be able to serve that aging and disabled population in a way that we've been able to. So I strongly advocate for that. Again, there's been a lot of good work that's been done around it, and if it doesn't happen in this budget cycle, I sure hope we could look for something in the next budget cycle. The Department of Children and Families is the next thing on the bottom of page 5. There is an increase in funding, $10 million beginning calendar year 22 and $15 million over the biennium to support the child welfare system. Again, we sincerely appreciate the $25 million we got in the last budget. Made a big difference for us, has helped us a lot in being able to serve kids. We do know that in this budget that the governor has proposed that there's some good increases in the foster care and kinship care rates. And so we know we'd need some additional funding to be able to cover those. Those programs do deserve some additional increases, so we would certainly support that. And at the top of page 6, there's some additional funding for some direct family support services. And I don't know, Erin, if you have anything you want to add about the value of how we've like the TSSF and how that's made a difference in kind of preventing placements.
And I think the programs similar to like TSSF and in-home safety services have been huge in our county, and especially with the Families First legislation that's coming out with being able to maintain our children in the home or in a home-like setting. Those types of grants are going to be huge for us to be able to continue to receive.
So I'm kind of skipping over a lot of the pieces of it. The one thing I can tell you that is probably on starting on page 7, the very biggest issue for all county human service departments are the wide sweeping changes in youth justice. There are so many changes in here, it kind of makes our head spin. Probably the biggest challenge that we have with this is the department, although Wisconsin County Human Services Association and WCA has enjoyed a good working relationship with Secretary Amundsen and the Children and Families Department. We were completely unaware of any of these proposals or any of these changes. And while we all agree that youth justice certainly has time for improving how we do things, and the conversation about do we include 17-year-olds I think is a fair conversation, how we do that needs to be a conversation with counties, because to come up with an idea and the counties do all the work, and to not have included them in this conversation makes it really difficult for us to respond in a meaningful way to what this budget is saying. It's moving 17-year-olds back into the counties, which certainly developmentally makes sense for those kids. The governor's proposing some sufficient funding for that. Some sufficient means what it costs you, we will reimburse you. I highly doubt the legislature will give us that, as nice as that is. There is a budget, and I'm not expecting that they're going to give us some sufficient funding for that. And then that becomes the rub of how much money are you willing to give us. They're also changing the entire serious youth offender and changing it into a extended juvenile jurisdiction model, wherein we would serve kids through their 18th and 19th birthday. So now we're not just getting 17-year-olds, we're getting some of these other kids. There's also changes in terms of taking away places we can put these kids. So you ask us to serve more kids, but fewer places to put them. And closing the juvenile detention facilities as a sanction would not be an option anymore. Eliminating an available disposition of the Juvenile Justice Code, the placement of a juvenile in a juvenile detention facility or county jail. That's not going to be allowed. Any restraints for those under 18 when appearing in court, although I don't disagree with that one. And then changing, one of the other big pieces, changing the age of delinquency from 10 years up to 12 years, which we also think makes some sense. But eliminating the state-run type 1 facilities, again, the SRCCYs, I'm thinking I'm missing a letter there, was a proposal that was put out a couple years ago. As it turns out, there's only one county on the eastern side of the state that's even considering building one of them. So again, moving more kids to us and fewer places to put them really creates a huge challenge for us as counties. Counties will love to be part of a conversation about how do we serve these kids better and do a better job and use the resources we have in a better way. We just aren't real excited about the proposal in the governor's budget. So that would be our comments on that. So those are our comments in general. I don't know, those of you, again, who are legislators, representing legislators, have anything you'd like to add or any questions you have for us? But this is kind of our opportunity, or if any of the board members here in the room have any questions. I do. Go ahead, Sally.
Yeah, when the red light is on your thing. Okay. My name is Sally Miller. I am a county board supervisor from District 3. This is to our state legislative representatives and such. It's already been stressed, the need for mental health resources and crisis beds. I'm going to add to that conversation. It's not theoretical, it's not hypothetical, it's real. We have families in crisis with no way to respond because sometimes a crisis bed is what is needed. Sometimes the mental health crisis is so profound that even the best families need help. They need respite. It is beyond their ability to manage the current crisis. Having a mental health crisis bed is critical to reducing not only the anxiety of the family, but also the individual in the crisis. This is not a choice that they're making, and this is not an option for them. This is not something that they created nor caused. This is an organic issue that goes to chemicals, it goes to parts of how their body works. And for us to be putting them in handcuffs is criminalizing mental illness. We don't put people having heart attacks in the back of a police car with handcuffs. The brain is part of the body, and it is a medical condition that involves how we perceive things. And we need to treat it as the medical condition that it is. To sit in an emergency room with somebody you love for 19 hours as you play crisis bed roulette or lottery, waiting for that damn bed to open, to be told 4 times a bed has opened, and then to be told that it's not available. I tell you this with personal experience with someone precious to me. I've done it too many times. I am on this board because of this issue. And I have been looking to the heavens. I have been looking to the federal government. I have looked to the state. We need help. I am a domestic violence advocate by day. I work with families in crisis. I'm seeing the overlap of untreated, undiagnosed mental health. I'm seeing the overlap with the addictions. I'm seeing the overlap with trauma. We're talking about children who need help. Well, they're quite often in a situation where mental health crises are developing because parents might be overwhelmed, or there might be mental health in the home, or mental health might be happening. We start dealing with the mental health crises that are in our communities, we're going to be able to start dealing with some of these other issues. Domestic violence will go down. Child abuse will go down. Addiction will go down. We will start spending less money on treating things and more money with making life better for people in crisis and their families. This is not, as I said, this is not anecdotal, this isn't theoretical, this is real. And when you live in a county like ours, like so many of our counties, when you look at it, 90% of our United States is landmass-wise rural, 20% of the population is here. We don't have resources. We don't have public transportation. So if you have a person with an untreated, undiagnosed mental health condition, and they might be open for getting services, how do they get there? How do they get that help? The money is not there to do the things that we need to do. But the crisis bed situation, everybody brace yourself. That's just pure undiluted bullshit that we're doing this. And it needs to be funded. We cannot be taking people across the state in handcuffs. We can't be taking people far from their homes and stabilizing them in random places. There needs to be a better plan. We can do better than we're doing, and we need a coalesced effort. And I am looking to the people at the state level to do this. And if you need help making calls, writing letters, you know, I'm your girl, Sally Miller. Give me a call. Thank you.
I couldn't have said it better, Sally. Thank you. Yeah, Jeannie.
Just to kind of piggyback on what Sally's saying is, I think based on how we have all lived for the past year, children as well as adults, we're going to see, and we're already seeing it, and kids aren't getting treated for the mental health issues that they're dealing with. We're seeing death by suicide by kids as young as 7, 8. This is not a situation that's just going to go away, and it has really been intensified in the past year because of how we've had to educate our kids, how we've had kids in isolation, how kids, you know, parents have been in isolation. I was just talking beforehand with Sally. When we are all let loose, whenever that might be, it's going to be crazy. So yeah, this is a really serious issue. And I hope and pray that you all in Madison are gearing up for this, because as part, and I think WCA is going to address this in a letter, because our last meeting, this was like front and center on everybody's issue when we were talking as a group. So please, we're begging you.
Thank you.
If I can address some of that. Sally, I agree with you 100%. I myself have a daughter that has gone through some battles and struggles, and I've been fortunate enough to attend a couple of appointments with her, her mom and I, since they only let one person in right now, which I don't like at all, especially when you have parents that are trying to do what's best for their child. But I agree with you wholeheartedly that we should not be transporting anybody across the state. We should try and get the resources locally that are available to them, because what we're finding out is we can go ahead and transport them to Winnebago for the 72 hours, but they don't get to the root cause of what's going on. So what do? We bring them all back home here to try and get the services available, which costs the counties more money. It would be my ultimate goal, and it has been a dream of mine, to get law enforcement removed from this completely. We shouldn't be arresting, it's not, we're detaining them for their safety and interest of others, because at that point we find them a harm to themselves or others. So the handcuffing is part of policy and procedure, sadly. And because if something happens on their way to Winnebago, medically, we don't have the resources available to treat them right there on the spot. So we're dialing 911 to come and help us. Mm-hmm. So, I would love to remove law enforcement from this whole procedure, and I'm looking at a few things, but, you know, in Madison, you have entities to battle, and that includes the counties association as well as the hospitals association. So we have to sell it better, and we have to bring the reality of what our youth and adults are facing today, so that a better picture is painted. And by you sharing your stories like you did, Sally, that's what we need.
Jesse, in October of 2019, the Attorney General's Summit on emergency detention, I don't know if you were there or not, but we actually got clarification that they could be transported, that the sheriff shall transport or shall cause to be transported, and so we got him to nail down that they could go by ambulance if we so chose to do so. I came back, I literally recorded the Attorney General saying that on my phone, came back ready to go to Corp Counsel and say, okay, I have a plan. I had the sheriff sitting next to me, I told him, you know what's coming next, but then we hit a block somewhere. But I did get the Attorney General on record saying we could transport by other than sheriff, that the sheriff deemed. So if you could look into that.
Yeah, you're absolutely right. We did pass legislation that allows counties to use a third-party vendor to include ambulances, and that was passed in fall of 2019. It was probably after the Attorney General Summit. Okay. I will look into that further to see where it exactly is. It may not, well, I thought it passed, but I'll have to double check on that.
Thank you.
I think the lingering issue, of course, is where they're being transported to. And again, as we all agree, the many miles away and the many hours is just, it's just inhumane. Unless there's other questions in this room, I would like to ask those of you representing the legislators, can you tell us a little bit about the next steps of where this budget is going to go? I suspect with the governor being one party and the majority in the legislature being a different party, there'll be some serious amounts of renegotiating this budget. And so understanding where this goes in the future would be helpful if you have any information you could share with us.
This is Nathan, Senator Bernier's office. So as some of you may know, the senator's recently been appointed to the Joint Finance Committee, and the Joint Finance Committee is the legislative body that will take the first kind of crack at the budget and come up with a version that represents the legislature's interest on this. The latest word I've heard is that they will be kind of starting from last year's budget as a starting point. But as they go through, obviously, they will consider the governor's proposals and take a vote on a lot of those. So I would expect some of the things that the governor proposed will make it into the final budget, and probably quite a few won't as well.
I have a question of him. Could you promise me that this will be a bipartisan effort? Because everybody has kids, everybody has parents, everybody has families needing all of these services. It's not a Republican issue, it's not a Democratic issue, it's a human issue. And I would really enjoy some bipartisanship in this area of working with families, children and adults.
Sure. Obviously that requires both parties to agree on something, and ultimately, if the budget is going to become law, it'll need to be signed by the governor, who's of a different party. So there'll be some give and take on that. And obviously, when I was speaking there, I was speaking big picture, the whole budget. Transportation, education, everything that's involved in that. But yeah, for human services specifically, I know they'll look very carefully at where the needs are.
Any other comments from the legislative side? Or from the board?
Yeah, this is Bo. Real quick, just wanted to let folks know that the governor's office has just announced that they're holding listening sessions on the budget. So if you want to make sure to get your voice heard, when the governor is to sign the budget, now would be that time. They just released a few dates. So check out their website and feel free to participate.
Do we know when Joint Finance will be having their sessions, or if they'll be having sessions, or is it too early to know?
A little too early. Nothing's been announced yet, but what I've heard is that there will still be some sessions, probably a lot of online options, but I haven't heard anything concrete yet.
Well, thank you very much. I sincerely appreciate your time for Nathan and Bo and Representative James for joining us. If you have any other questions, we'd be more than happy to provide information to you specific to our county. I know this is going to be an interesting process, and I'm sure we will continue this dialogue. So thank you so much for your time today. It's very much appreciated.
You're welcome. Thank you.
Thank you.
Yes, thank you. And appreciate all the info that we received via email too. That helps a lot.
Thank you. Thank you. You have a great day.
You too.
Okay.
Okay. Go into closed session?
Yep.
Can I just say something before we go into closed session? I really hope that when there's a listening session to talk about some of the human services stuff, because the whole, like, I'm just reading this juvenile justice stuff and my eyeballs are like, what? You know, because delinquent kids kids involved in the juvenile justice system have so little options for placements. And the placements that are options are so expensive. We're talking treatment, foster care, we're talking residential treatment. You know, I'm looking at the puny little increase in foster care payments. Oh my God, that's like archaic. So.
Thank you.
I need to be on those listening sessions. Can you talk during a listening session, or do you have to be quiet?
I think the governor listens and you talk, so.
Okay, all right, good. Sally, we'll be there together. No, it was really helpful. I'm glad they were there. I just didn't want to monopolize the conversation, but the whole stuff in juvenile justice was kind of blowing me away as I was reading this. It's very different, and it's going to increase because caring for 18 and 19-year-olds is not cheap.
Okay.
Okay, sorry.
Well, no, that's okay. I didn't need a motion to go into closed session.
I'll read it. I'll make a motion to go into closed session pursuant to Wisconsin State Statute 19.85, Parent 1, Parent G, to confer with legal counsel for legal advice with respect to litigation in which it is or is likely to become involved.
I second.
Sally, second? Okay.
Who all is on there?
There's representatives from the healthcare center on there, and I don't know who the blurry one in the corner is.
I think it's Jerry.
Okay, Diane. Diane, you can check out at this point. Just turn off your computer and sign off.
She's going to leverage. Yeah, the no video thing.
I don't know if you want to leave the
So is
healthcare
closed
center
session going to
in as
involve the
part of this.
healthcare center?
Yeah, so they.
Okay.
Okay. Roll call vote. Diane?
The original plan was
Michelle?
approved by the.
Nutter?
Miller?
Diane? Or Karen?
That's Karen.
Yes.
And I'm yes. Okay, we're in closed session. We're back in open session, and we'll move to the action on items discussed in closed session if needed.
No report.
No report. Approved 2021-22, the WEEP Energy Assistance Contract changes.
So we brought this topic to you last month. We get around $40,000 to $50,000 a year to pay for some staff to take in energy assistance applications for the heating season. And for the last oh gosh, probably 4 years or so, we've contracted with Western Dairyland. Prior to that, starting in 2013, we'd contracted with Western Dairyland just for crisis services, but then we added the other services. And so all the money goes through us, they do all the work, but then, and I'm technically the WEEP coordinator, which I'm apparently according to Department of Administration, the only human services director who is the WEEP coordinator, but we don't really have anybody else who can do it. So the state suggested to us that perhaps, which we did not know was an option, is that the state could do a contract directly with Western Dairyland. And so we have reached out, we brought this topic to you last month. We did reach out to Western Dairyland, we did reach out to the state. Western Dairyland would be interested in this starting October 1st, which would be the beginning of our next contract period. We did contact the state, and the state said as long as this board approves that, and as long as Western Dairyland's okay with it, they would support that. So what I am recommending to you today is to make a motion to transfer the 2021-22 WEEP contract to Western Dairyland.
Okay. Need a motion to approve that energy assistant contract with, for Western Dairyland
Yep.
to take it over.
Yep.
I make a motion that the Department of Human Services move their, enter into a contract with Western Dairyland in October.
I'll second.
Sally seconds. Okay, all those in favor, we don't need any voice vote for that, just a voice vote, right? All those in favor signify by saying aye. Opposed, same sign. Carried.
Can you turn these letters back in?
Yeah, because they were on.
Yeah. Do you want to collect them, Erica?
Message 10. Well, I don't.
Okay.
Okay.
Erica?
Yes,
Okay.
easy set, so. Yeah.
Okay, so continuing on, I'm not going to walk through a lot of detail on here. We have been giving you updates on the strategic plan. This is part 4, and thankfully, the final installation of this report. This is going through priorities 3, 8, and 9, and I'll just do a very high level. Priority 3 is how do we embrace diverse populations? And we have, learning more about the populations, increasing diversity in our workplace. We annually, as we let you know, we have a performance tool that we talk to staff about. And staff, we asked them this year very specifically for 2021 to create goals for several different areas of the strategic plan that would fit into it. We've had several staff that want to provide training to our staff or bring information to our staff about diverse populations. So I think that's going to be a really wonderful way to be able to do that. Our next one is how do we communicate our services and needs successfully? And we've had this for a long time as our goal, and so we're going to be creating as a leadership team a communications plan by mid-year to bring to you. And the communications plan, I think, will really provide some direction on who speaks for the department when, how do we do press releases, what's the format, how do we get those approved, all that sort of thing. We've been doing it kind of on the fly, but really this, as big as we've gotten, we need just an official communications plan. So we'll be working on that and bringing that to you this summer. And then how do we maintain and create healthy partnerships while maintaining our identity? And again, this is really about working with our partners. In fact, interestingly, the 2 new grants that we got in 2020 were really about working in partnership. The Dementia Care Specialist is a partnership with Trempealeau County, Buffalo, and Pepin counties. And the Community Partnership Grant is having juvenile justice work with behavioral health, with schools, with law enforcement, with healthcare. So I think that's really become a good part of our identity. The reason we have it in the strategic plan is because there was a time several years ago where everything was becoming collaboration and you joined up with a bigger county, and some of the small counties started losing their identity. And I know Trempealeau County is very unique, and we are fiercely independent in our county, and so we didn't want to lose our voice. And so that's really what this is about. And I think we've been able to find the healthy balance of working with partners, being a trusted partner, but still having our own voice. So I'll let you read all the great details in this, but that's just a high-level review of the strategic plan. I don't know that you need any motion for that.
No, okay. All right, we'll move on to approving the new ADRC Advisory Committee members.
So we're going through currently, and we're contacting the ADRC Advisory Committee members to see if they still want to be on. We haven't had a quorum in that group for about a year, so we will be meeting in April, and we will offer a live and a remote option for people to be able to join us. We want to have a quorum. We want to get back into business. But we've lost one member passed away. We know at least one other member has opted to not continue. So I have 3 names to bring to you to bring. There's one person that hasn't decided if they want to stay on, so I don't know if the third person would be on. But we have Ruth Gullicksrud from Strum, Kim Silla from Ettrick, and Sherry Haynes are the 3 names that I would like to bring forth. Again, I will confirm with the remaining members of the committee if they want to stay on or not. We've had a couple say, well, I'd be interested, but I just can't make every meeting. And, you need somebody who can really commit to it one way or the other. So we're going to be following up with them. And then these would be the names that we would bring forth as some new members to the committee. Again, staying within our bylaws of making sure, the bylaws say there should be no more than 12 members. So we want to make sure that we stay within that requirement. So I guess I would want approval from you for those names, and then we can advance those to county board on Monday, and I'll have a final number on Monday.
Who were the 3 now?
Ruth Gullicksrud from Strum,
Yeah.
Sherry Haynes from Arcadia, and Kim Silla from Ettrick.
What's that, Ken? Or
Kim.
Tim Phillips?
Kim Silla.
Oh, Kim Phillips.
Is Scott Brown still going to be on?
He will continue.
Oh, good, okay.
Okay, we need a motion to accept those 3 names. Michelle? Second to that? Okay. Sally, you're won second place today. All those in favor signify by saying aye. Aye. Opposed, same sign. Carried. Okay, the financial report.
So the financial report, I kind of highlighted, this is our best guess through December. I highlighted this in the annual report that I presented earlier. We are looking at having a net gain at the end of the year. We really were earlier in the year thinking that might not be possible. But thankfully, we were able to secure some good amounts of COVID funding. Just in the ADRC, we were able to secure almost $100,000 of COVID funding that was just given to us. We didn't even have to apply. So that is making a big difference for us. And then getting some of our final bills cleaned up, was able to bring in some additional resources as well. So this is our best guess at this point. Again, there's some in Fund 202, of which means there could be, some will go to the nutrition fund that you set up a few years ago, up to 100,000 can go in there. We would be then at the end of 2020, we'd have about 221,000 set aside for nutrition programs, which will go a long way to providing some stability for that as the federal funding and state funding continues to erode. And then Fund 203, there could be some reserves as well set aside there. That will be for transportation and nutrition. So again, we're still waiting to get some final reports in from the state. The auditors will go through this with their fine-tooth comb, but this is our best guess at this point. So it ended up very, very good.
One to go here, personnel report, thank you.
So, our personnel report, we have 2 vacancies that are currently being advertised. One is the ADRC supervisor. We're hoping we can maybe do interviews late next week, early the following week. We're going to be looking at applicants, so we'll be getting that finalized. We do have the mental health or behavioral health tech position that you approved last month to change a social worker to a tech position, so that is being advertised currently. And then we have 2 vacancies of behavioral health leads. That's existing staff that would then become lead workers. So that is going to be posted shortly. So once we get the ADRC supervisor and the mental health tech on board, we will be fully staffed at 53 or 54 positions. So that's a lot. That's as close as we've been in a long time. I suspect there's just always turnover and things happen, and but that's pretty good for us. Yeah, knock on wood. So that's my personnel report. That's all that I have.
Questions?
Do you know how many people, do you have good applicants for the ADRC, or don't you know yet?
Part of the reason we haven't done interviews sooner is we've had a very small pool. We were hoping to get more applications. We've gotten a few more coming through, so we're hoping that from that we can get a good pool of candidates. Typically, we have a board member participate in those interviews, so if any of you would like to join, let me know so we can do that.
Maybe I should apply.
Anything else?
That's all I have.
Okay. I believe the next meeting is the 12th of April. Is that what you have?
That's what I have.
Wow, April.
Easter will be over.
When is Easter?
The 4th, yeah.
4:54. Okay, not 4, 5:54. We adjourn at 5:54.
Thank you all very much. This is a long meeting. We covered a ton of stuff. I appreciate all your patience. Thank you.